when coming to a country that you've never been to, it's like going into the darkness. You don't know what to expect. And so some of those anticipations could be answered before you arrive. And in that regard, I'm looking at your telemedicine department downstairs.
In many other Apollo hospitals, we have a teleconferencing in which we discuss the condition of the patient, take second opinion, third opinion, things like that. Telemedicine is the present and the future. It
is the present and future. That was one of the questions that were coming up in my mind. If I had been able to do that before I came, for example, I know it's brand new now, that might have offset some of the difficulties that I encountered when I arrived. And of course, some of the things they only know whenever they examine you, but certain things they can find out in advance. And this would be a big question in people's minds.
Yes, we are trying to upgrade the system. There are very few softwares now available. You can transmit your X-rays, CT scans, and ECGs, and EMGs, and things like that. That makes it easier for the consultant over here to understand things. But otherwise, yes, we are on the move to improve the telemedicine in Ahmedabad.
And I had a question about, you have the international wing now, the platinum wing. Is there plans for more expansion of that?
Yes. As you know, we have 10 rooms there and
yes.
They are almost getting filled. I think we are taking a look at it, and the opposite side, the other side of that probably will be, by the end of this year, we'll have a new platinum wing again, which will increase the bed capacity for these patients to about 25.
So that's going to expand your capacity to deal with a larger user.
Yes.
Now, what about the cancer ward? I see that there's something about that.
Yeah, we have an agreement with again a American company called CVCC. This is our partner in the cancer management here, both in terms of chemotherapy and radiotherapy. They have some of the wonderful equipments in radiotherapy you must have seen, and this is a part of our hospital. But the administration, the management is by CVCC. They come here, doctors belong to us. The facilities and expertise, and it's a revenue sharing arrangement. But it works well. We have some number of cases under one roof, both for chemo and the radiation therapy.
So there are a lot of interest in being able to find out if there's something wrong with you before it becomes a major problem.
Sure.
And so if someone were concerned about their health and that they had not had health screening, there's a health screening program.
Yes. This is again the thing of which Dr. Reddy has started, that every individual must have a health screening, what we call Apollo Preventive Screening Health Program. Now under this we have some packages like well-woman checkup, the executive checkup, the whole body checkup, that within a given tariff you come and get yourself completely investigated, right from top to bottom, and it's a whole body checkup. They do your hemogram, all the blood tests which are required, and you are being seen by a physician, by a consultant, by a gynecologist if you are a female, eye specialist, ENT specialist, and they give you a comprehensive report on the state of your health. If there are danger marks, they will explain to you. Okay, look, your lipid is high, be careful. If you are gaining weight, they will again explain to you. Okay, look, you are slightly getting beyond the permissible limit, check yourself. If your sugar is there or potentiality of being diabetic, they will warn you. So this preventive health check program, which should be done by every individual every year, is a program to keep the records of your state of health. And it's like any other, like you go for your car servicing,
you got to service your body. I know as I get older, I need to get serviced.
And it helps if you start at a young age, in 30s and 40s.
Then we have a pattern to follow.
Yeah, and you can see the progress of deterioration of your parameters of your health. Maybe blood pressure is alright, now started going up. Okay, what do I do? You don't have to take treatment all of a sudden. Sometimes it happens that prescription is not that good at all, and the better thing is a description. If I can explain to you, look gentlemen, don't do this, don't do this.
So
probably it may help you. What we call the wellness system.
A minor correction in your habits
can
make a big difference in your long-term health. I know a couple of weeks ago I was downstairs and someone was describing, I guess, their sister that came for a checkup from the UK for one reason, and they found out that she had a 70% blockage, and so suddenly she could have died from this because she didn't know, and this discovered that.
And though now the more and more people coming, I would like a younger generation to come, those who are just getting into 40s or 30s, late 30s, because from there the stress started building up more, and the more the stress, the more these parameters keep changing. Your cholesterol level, your sugar level, your all sort of thing. And in India specifically, diabetes and hypertension and the cardiovascular disease is a big problem. It is going to be a big problem. The what we call the lifestyle diseases. Today, you don't get a bunch of cholera, smallpox, chickenpox, all those things. You get lifestyle diseases, hypertension, diabetes. Your food habits are different.
Yes.
Your stress levels are different. You are competitive in life, and all these things lead to some certain changes which you must be monitoring. And our Apollo preventive health checks do that.
Well, as you know, in the U.S., there's probably 40 million Americans without any insurance whatsoever, but their health is at least as bad as everyone else's. So they need the same kind of care. And I'm sure that the question is, how can they incorporate things like a vacation along with some health care? And this would be where these health checkups might come in and that sort of thing.
When you are touring India, just make it a point to go to any Apollo hospitals, or if you are touring Gujarat, come to Ahmedabad. You need to spend only 7-8 hours with us, and we can send you a report by courier if you require, or by email, but at least the checkups are done. What we usually do is ask the person to come at this time, get his blood stool, urine, the test done, give a breakfast, complimentary breakfast, and then continue with his physical examination. And this is all finished within 4 to 5 hours, including the vision test, the dental test, and all that. And at the end of the day, if there are some parameters which are abnormal or looking towards abnormality, the consultant sit with you and advise you. I think this should be a part of any tourism.
So if they're going to come for a tour, they can just blend this into the tour when they come down?
You never know, you will detect something which you never think of.
Yes. I know in the U.S. there's an overweight problem, and that leads to problems with the joints, where they start having to have joint replacements and things like this. And many of these things may not be covered by insurance.
Yeah. We have a joint replacement team here. We have conducted many operations in joint replacement. It is very cheap. It's not going to cost you more than $3,000 to $4,000 for one knee.
Compared to
what it is, and that is really good results. We have no infection, no problems. Some of the wonderful images you can see if I show you later on, that how the people who were totally crippled, they couldn't stand, they couldn't walk, they are now walking and standing.
Standing and walking. This is very important to many people. I think also there are people in my particular age category that they're getting older and they have much maturity and experience, but they're starting to lose out in the race for jobs and things because they start to look old. And this might be a major consideration. These things are not necessarily covered by an insurance policy, so if they're wealthy in the U.S. and they can have it done locally, but if they're really wanting this work done...
All I can say is if you're touring this country for the sake of fun, you will be going to some restaurant to spend some money. Spend that same amount in coming to the preventive health checks and you are here something positive.
And what about the cosmetic surgery? That's what I was actually starting to get to.
Cosmetic surgery we are trying to develop. As you know, plastic surgeon cooperated in your wife.
Yes, my wife just had it and I must tell you that it turned out just fine.
Okay. We also have another lady who is a cosmetic surgeon. This is something which we want to improve upon. And we are now getting some more equipments and I'm sure cosmetic surgery will become the key attraction in this hospital very soon. It is already, but...
Yeah, I think it is. Because I'm in that age category where I'm starting to think about these things, and I would like to extend my workable life for another 10 or 15 years. And so, meeting Dr. Ayathan, by the way, I think he's a very magnificent person. He's done a wonderful job for my wife. And I'm now seeing that now that the stitches have come out and all of those things, she looks 10, 15 years younger, and he said it's going to even get better. So it's making me think that I may have to have a little work done myself.
all this leads to what we call is a wellness center.
Wellness center.
I'm also planning, as it is there in other hospitals, alternative medicine centers in which you have music therapy, you have some other things which is incorporated along with the patient care in the traditional way, the way you do the surgery. Now you'll be surprised that post-surgical patients are now put to the musical therapy. It helps in their recovering process, it helps in the healing process. Not something that are coming up, and they are practiced in Apollo groups.
So how does that work? How does the musical therapy work?
Well, you just put it's like any other stress mechanism, I suppose. You just put him into a room with a beautiful ambience and lovely soft music is going on, and he recovers post-operatively, sleeps there for some time and gets benefited with that. So, and there are many other therapies in India which are useful.
Yes, they are. I know in dentistry now they're using a lot of that sort of therapy. They put the headphones on and give you some relaxing music and something to distract your mind while the procedures are going on. I would like to see some laughing gas be incorporated into this process. I know it's happening a lot. I don't know what difficulties you would encounter there, but for me, I think if I were going to make one suggestion, it would be some laughing gas occasionally.
We will look into it.
Well, thank you very much. Dr. Pawar, you've been so kind. Is there something else that we could do?
Thank you very much. I'll take our best wishes. Recover soon. Come back, not as a patient at times, but as a visitor.
I see
I'm very happy to see you. And convey my regards to everybody back home.
I will.
And tell them that yes, we are here. We are one of the world's best hospital here, and we would welcome them within time limits of whatever they want to do. People want to take leave for 10 days, and within that, if something can be arranged, we will do that.
Wonderful. I think if I were going to suggest something to your boss, I think it's Dr. Reddy, I would say you have a wonderful man here. He does a great job.
So
thank you so much.
Thank you very much.
Dr. Pawar,
God bless you.
Thank you.
Take care.